The opioid crisis is real, and the 200,000 dentists in the United States write a lot of DEA-controlled opioid prescriptions. And I just wanted to provide you some information which I found startling, which was on CBS 60 Minutes on a segment that they did on June the 30th of 2019. And this little segment will probably be only 4 or 5 minutes, and this will be followed by a protocol that you might consider that will cut down markedly on the opioids that you dispense to patients. The principal person interviewed on this program was Mike Moore, who organized the lawsuits against the tobacco industries back in the 1990s, which led to market changes in the industry, which have since led to a marked decrease in smoking in the United States. ARCOS is an automatic comprehensive drug reporting system which is now in effect, and it monitors the flow of DEA-controlled substances from the point of manufacturing through the commercial distribution to pharmacies and to points of sales and distribution. This means that you as a practitioner are going to be more liable in the future for the prescriptions that you are writing, so be prepared. Here's a fact that I found absolutely startling. In a small town in West Virginia, one pharmacy over a 2-year period of time dispensed 9 million opioid pills. Yes, you got that right. A town of 400 over a 2-year period dispensed 9 million opioid pills. The governor of Ohio is a former attorney general, and he is very much behind dealing with this crisis and gave us some facts about Ohio. In 1 year, 1 billion pain meds were prescribed in Ohio. Let me tell you how many that is. That is an average of 69 pills for every person in the state. He estimates that Ohio is losing $4 to $5 billion a year, and from 5,000 to 6,000 people are dying a year in Ohio from the opioid crisis. In the United States, 2.5 million people are addicted to opioids. And get this, each year 72,000 people die from opioid use. So far in the United States, 500,000 or 500,000 people have been lost to this crisis. Now, let's go to the video on what we can do as dentists to avoid writing opioid prescriptions. This is a protocol that worked very well for me and hopefully will work for you. Now that I have reviewed for you the statistics from the 60 Minutes program, I'd like to discuss to my dental colleagues what we as dentists can do to avoid the opioid crisis and provide the services our patients need. The 3 things that we're dealing with. One of them is pain, one of them is anxiety, and one of them is swelling. For when we have swelling, we have soreness. So if we can control the pain, if we can control the anxiety and control the swelling, the patients are not going to have any particular pain. The epiphany came in my practice with the development of the anesthetic, local anesthetic Marcaine. We talk about Novocaine, and Novocaine is a generic term, and Novocaine truly has not been used since the 1950s. We talk about Carbocaine, we talk about Xylocaine, and Xylocaine can contain epinephrine, or it cannot contain epinephrine. Carbocaine does not. And the thing about epinephrine, if the patient is anxiety, then we can have a certain level of fainting, and people think that they are allergic to those anesthetics, when in reality it's not a true allergic reaction. But let's not digress into that area, but let's focus on what this video is about. and what we as the 200,000 dentists in this country can do to control the opioid use and distribution in our practice. I did my periodontal surgery under xylocaine with epinephrine. The epinephrine reduced the amount of bleeding, and it was a very profound anesthetic. But the key and epiphany came when the manufacturers developed Marcaine, which has the property of lasting for many hours after the surgery. So what I would do is I would go in and re-anesthetize the patient, including bilateral mandibular blocks if necessary, knowing that this is going to keep the patient numb for a number of hours. We would have the patient bring with them some naproxen sodium, which is a leave. And if you look on the product information, this will last up to 12 hours, much longer than some of the other over-the-counter medication. If you look at the product information on the leave, you will note that it lasts up to 12 hours, much longer than the other over-the-counter medications, which probably last anywhere from 4 to 6 hours. This is a true advantage when you have something that is going to last that long. So therefore, we would have the patient bring the naproxen sodium, the Aleve, with them, and as soon as we were finished the surgery, we would give them an Aleve. Now, this is a fact that probably some of you may not be aware of, but if you just take a pill with a sip of water on an empty stomach, the absorption rate is not particularly good because the stomach needs to be distended to some level to be sure that the medication is absorbed. Now, some of our surgeries took 2 and 3 hours, and the patient may have had a minimal amount to eat before. So routinely for years, we had given our patients a glass of orange juice to elevate their blood sugar after the procedure. Some of the patients would like to bring a milkshake with them or something like that, but anything with some substance to distend the stomach was what we were looking for. They were then instructed when they went home with the Aleve about 6 to 8 hours later, remember that this medication lasts for 12 hours, to take the second Aleve. So therefore, that Aleve would last for 12 hours. So therefore, by having the original Aleve at the time of surgery and the second one about 6 to 8 hours later, then the patient was going to be kept pain-free for another 12 hours after that. And if they need to take a third, they certainly could. But the patients basically were pain-free on that. Now, certainly we use some Versed and some Demerol, for instance, to control anxiety, and you can add some antiemetic medication to your IV solution to prevent nausea. And certainly with Demerol, you have an antagonist in Narcan so that you can control that as well. So it's a very safe protocol if you're using the IV solution. However, if you're not using the IV solution and you want to control swelling and cut down on soreness and tenderness, then you can use the Medrol dose pack. And if the patient is going to have the surgery done in the morning, they can start that medication the night before, or if they're going to have it after lunch, they can start it in the morning. So therefore, by using the long-acting anesthetic Marcaine, we control the pain. By using the combination of Versed or perhaps some oral analgesic, we can control anxiety, and certainly we can reduce the swelling to a very minimal by the use of the steroid on that. However, if you're going to use this protocol, it's imperative that you communicate with the patient at the pre-surgery appointment exactly what is going to be done. And my dental assistant, Margie, was excellent at this because she would go in detail to reassure the patient that they were not going to have any pain. Therefore, the night of the surgery, we would give them a call to let them know how they were doing, and invariably they would still be anesthetized, and although they might be groggy, they very much appreciate the phone call. But the key telephone call was the next day, where we had a telephone right outside our surgical suite where Margie could take a brief time about 10 o'clock in the morning once a patient was awake to give them a call and see how they were doing, and just to sit and listen to them tell how well they have done. Now, patients are somewhat apprehensive about the protocol, as justifiably they should. So we would typically write for 4 to 6 tablets of some opioid and encourage the patient not to get that filled unless they truly had pain. And although I didn't really document that back when I was in practice, it seems like to me that very few patients ever got that filled. So now I've given you a protocol on how to take medication, what medications to use, and what medications that can be used over the counter to control anxiety, to control pain, and also reduce swelling so that the patient does not have the discomfort that comes from swelling. Hopefully this will have an impact on your practice, and we as dentists can do our part to avoid the use of opioids.